Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery urinary system part 2. In the current session, we will be discussing the CPTs regarding ureter and the CPT range is 50,600 to 50,980. Coming to ureter, ureter is again divided into subtopics like incision or biopsy, excision, introduction, repair, laparoscopy and endoscopy. The CPT range for incision or biopsy is 50600 to 50630 and for excision it is 50650 to 50660 and for introduction it is 50684 to 50695 and for repair it is 50700 to 50940 and for laparoscopy the CPTs are 50945 to 50949 and for endoscopy they are 50951 to 50980. Now coming to CPTs for incision or biopsy, the code 50606 is an add-on code that describes the endoluminal biopsy. Endoluminal biopsy of ureter and or renal pelvis non-endoscopic including non-endoscopic including imaging guidance, that is ultrasound or fluoroscopy, and all associated radiological supervision and interpretation. It may be reported once per ureter per day. Once per ureter and per day. And this code includes the work of the biopsy and the imaging guidance and radiological supervision and interpretation required to accomplish the biopsy. The biopsy may be performed through de novo transrenal access, an existing renal urethral axis or transurethral axis or iliac conduct or ureterostomy, and the service of gaining access may be reported separately. And the diagnostic pylography or ureterography is not included. Diagnostic pylography or ureterography is not included in the work of 50606 and may be reported separately. Other interventions or catheter placements performed at the same setting as the biopsy, they can also be reported separately. So access, the service of gaining access may be reported separately. Diagnostic pylography or ureterography may be reported separately, and other interventions or catheter placements, they may also be reported separately along with 50606. And for codes 50430, 431, 432, 433, 3435, 606, 693, 694, 695, 705 and 706, the renal pelvis and its associated ureter. This we have discussed yesterday also in the previous session. The renal pelvis and its associated ureter are considered a single entity for reporting purpose. Ureter and the associated renal pelvis and its associated ureter are considered a single entity. And the codes 50430 to 50706 may be reported once per each renal collecting system or ureter accessed. For example, two separate codes would be reported for bilateral nephrostomy tube placement or for unilateral duplicated collecting system or ureter requiring two separate procedures. May be reported once for each renal collecting system or ureter accessed. If the ureter is accessed twice, you need to report two separate procedures. And whenever a bilateral procedure is performed, then also two separate codes would be reported. Coming to the first CPT 50600, ureterotomy with exploration or drainage. And for ureteral endoscopy performed in conjunction with this procedure, you need to refer 50970 to 980, 50980. The next is 50605, ureterotomy for insertion of indwelling stent. Ureterotomy for insertion of indwelling stent, all types. The next is the add-on code that we have just discussed earlier, 50606. Endoluminal biopsy of ureter and or renal pelvis. non-endoscopic, including imaging guidance, for example, ultrasound or fluoroscopy, and all associated radiological supervision and interpretation. And as this is an add-on code, it must be listed separately in addition to the code for primary procedure. And use 50606 in conjunction with 50382, 384, 385, 386, 387, 389, 430, 431, 432, 33, 34, 35, so on. It can be listed in conjunction with all the below listed CPTs. And do not report 50606 in conjunction with the following CPTs. For same renal collecting system or associated ureter. The next CPT is 50610. Urethral Lithotomy, upper 1/3 of ureter. The next is 50602. Urethral Lithotomy, middle 1/3 of the ureter. The next is 50630. Urethral Lithotomy, lower 1/3 of the ureter. And for laparoscopic approach, you need to refer 50945. And for transvesical Urethral Lithotomy, you need to use 51060. And for cystostomy with stone basket extraction of urethral callus, the CPT is 51065. And for endoscopic extraction or manipulation of urethral callus, you need to refer 5008081, 561, 961, 980, 52320 to 52330, 52352, 52353 and 52356. And for uretocele, you need to refer 51535 and 52300. The next CPT is 50650. Urethrectomy with bladder cuff. Urethrectomy with bladder cuff. The next is 50660. Urethrectomy total. Ectopic ureter, combination abdominal, vaginal and or perineal approach. For total urethrectomy, you need to report 50660. Now coming to next topic, that is introduction or other introduction. For example, injection, change, removal procedures. Here the codes are 50693, 694 and 695 are therapeutic procedure codes describing the percutaneous placement of urethral stents. And these codes include access, drainage, catheter manipulations, diagnostic, nephrostogram and or ureterogram when performed, imaging guidance. For example, ultrasonography and or fluoroscopy and all associated radiological supervision and interpretation. When a separate urethral stent and a nephrostomy catheter are placed into a ureter and its associated renal pelvis during the same session through a new percutaneous renal access. When a separate urethral stent and a nephrostomy catheter are placed into ureter and its associated renal pelvis during the same session through a new percutaneous renal access, you need to use 50695 to report the procedure. So let us see the first CPT 50684, injection procedure for ureterography or ureteropylography through ureterostomy or indwelling urethral catheter. And for radiological supervision and interpretation, use 74425. The next CPT is 50686, manometric studies through ureterostomy or indwelling urethral catheter. The next is 50688, change of ureterostomy tube or externally accessible urethral stent via iliac conduct. And if imaging guidance is performed, use 75984. The next is 50690, injection procedure for visualization of iliac conduct and or ureteropylography exclusive of radiological service. And for radiological supervision and interpretation, see 74420 for retrograde or 74425 for anterograde injection. The next CPT is 50693. Placement of urethral stent percutaneous, including diagnostic nephrostogram and or ureterogram when performed. Placement of urethral stent percutaneous, including diagnostic nephrostogram and ureterogram when performed. Image guidance, for example, ultrasound or fluoroscopy. And all associated radiological supervision and interpretation. Pre-existing nephrostomy tract. Here it is pre-existing nephrostomy tract. Placement of urethral stent through pre-existing nephrostomy tract. The next is 50695. 50694. Placement of urethral stent percutaneous, and all are included, including diagnostic nephrostogram, ureterography, so on, till new axis. Previously it is existing nephrostomy tract, now it is new axis without separate nephrostomy catheter. And whenever new axis with the separate nephrostomy catheter both are done, the CPT is 50695. And do not report 50693, 694 and 695 in conjunction with 50430, 431, 432, 33, 34, 35, 684 and 74425 for the same renal collecting system and or associated ureter. Now coming to next topic, that is repair. The codes 50705 and 706 are add-on codes describing embolization and balloon dilation of ureter using non-endoscopic imaging guidance, and each may be reported once per ureter per day. They describe embolization and balloon dilation of the ureter using non-endoscopic imaging guidance. And these codes include embolization or dilation plus imaging guidance and radiological supervision and interpretation required to accomplish the embolization or dilation. And they may be performed through de novo transrenal axis or an existing renal or urethral axis or transurethral axis or iliac conduct or ureterostomy. And the service of gaining the axis may be reported separately. Similarly, diagnostic pylography or ureterography, they can be reported separately. And other interventions or catheter placements performed at the same setting as the embolization or dilation, even they can be reported separately because they are not included. Now coming to the first CPT of repair, that is 50700, ureteroplasty, plastic operation on ureter, for example, stitcher. The next is the add-on code that we have discussed earlier, plus 50705, urethral embolization or occlusion, including image guidance and all associated radiological supervision and interpretation. And use 50705 in conjunction with the below listed CPTs. Can be used in conjunction with all these CPTs. The next is also an add-on code plus 50706, that is balloon dilation urethral stitcher, including image guidance and all associated radiological supervision and interpretation. And use 50706 in conjunction with below listed CPTs. One more note is also there. Do not report 50706 in conjunction with these CPTs: 50553, 50572, 50953, 972, 52341, 52344, 52345 and 74485. And for percutaneous nephrostomy, nephrourethral catheter and or urethral catheter placement, use 50385, 387, 50432, 33, 34, 35, 693, 694 and 695. The next CPT is 50715. Ureterolysis with or without repositioning of ureter for retroperitoneal fibrosis. And for bilateral procedure, report 50715 with modifier 50. The next is 50722. Ureterolysis for ovarian vein syndrome. The next is 50725. ureterolysis for retrocaval ureter with reanastomoses of upper urinary tract or vena cava. The next is 50727. Revision of urinary cutaneous anastomosis, any type of ureterostomy. The next is 70728. Revision of urinary cutaneous anastomosis with repair of facial defect and hernia. The next CPT is 50740. Ureteropylostomy, which is nothing but anastomosis of ureter and renal pelvis. The next is 50750. Ureterocalicostomy, anastomosis of ureter to renal calyx. The next is 50760. Ureterostomy. And next is 50770. Transureterostomy, anastomosis of ureter to contralateral ureter. And codes 50780 to 785 include minor procedures to prevent vesicoureteral reflux. The next CPT is 50780. Ureteroneocystostomy. Ureteroneocystostomy, anastomosis of single ureter to bladder. And for bilateral procedure, report 50780 with modifier 50. And when combined with cystourethroplasty or vesical neck revision, use 51820. The next is 50782. Ureteroneocystostomy, anastomosis of duplicated ureter to bladder. The next is 50783. Ureteroneocystostomy, anastomosis with extensive urethral tailoring. The next is 50785. Ureteroneocystostomy with vesicopause hitch or bladder flap. And for bilateral procedure, report 50785 with modifier 50. The next is 50800. Ureteroenterostomy, direct anastomosis of ureter to intestine. And for bilateral procedure, report 50800 with modifier 50. The next is 50810. Urethrostigmoidostomy, with creation of stigmoid bladder and establishment of abdominal or peritoneal colostomy, including intestinal anastomosis. The next is 50815. Ureterocolon conduct, including intestinal anastomosis. And for bilateral procedure, report 50815 with modifier 50. The next is 50820. Ureteroileal conduct, ileal bladder, including intestinal anastomosis, for example, Bricker operation. And for bilateral procedure, report 50820 with modifier 50. For combination with cystectomy, report 51580 to 51595. The next is 50825. Continent diversion, including intestine anastomosis using any segment of small and or large intestine. For example, cock pouch or enterocystoplasty. The next is 50830. Urinary undiversion. For example, taking down of ureteroileal conduct, urethrostigmoidostomy or ureteroenterostomy with ureterostomy or ureteroneocystostomy. The next CPT is 50840. Replacement of all or part of ureter by intestine segment, including intestine anastomosis. For bilateral procedure, report 50840 with modifier 50. The next is 50845. Cutaneous appendicovesicostomy. For cutaneous appendicovesicostomy, the CPT is 50845. The next is 50860. Ureterostomy, transplantation of ureter to skin. And for bilateral procedure, you need to report 50860 with 50 modifier. The next is 50900. ureterography, suture of ureter. The next exhibit is 50920, closure of ureterocutaneous fistula. The next is 50930, closure of ureterovisceral fistula, including visceral repair. The next is 50940, delegation of ureter for ureteroplasty or ureterolysis. You need to see 50700 to 50860. Now let us see an example. The urologist is called into the operating room to repair a ureter laceration status post motor vehicle accident. The urologist examines the ureter and repairs a small 2 cm laceration of the ureter. So here ureterography is performed. The CPT is 50900. Ureterography, suture of ureter. Now coming to laparoscopy. Whenever we discuss about laparoscopy, surgical laparoscopy always includes diagnostic laparoscopy. So the first CPT is 50945. Laparoscopy, surgical ureterolithotomy. Ureterolithotomy. Laparoscopy, surgical ureterolithotomy. The next is 50947. Laparoscopy, surgical uteroneocystotomy with cystoscopy and urethral stent placement. The next is 50948. Laparoscopy, surgical uteroneocystostomy without cystoscopy and urethral stent placement. And for open ureter neocystostomy, you need to see 50780 to 50785. And finally, 50949 indicates unlisted laparoscopy procedure, ureter. Now let us see an example. A patient presents for removal of urethral stones via laparoscopy. So the CPT here is 50945. Laparoscopy, surgical ureterolithotomy. Now finally coming to endoscopy, the first CPT is 50951. Urethral endoscopy through established ureterostomy with or without irrigation, instillation or ureteropylography exclusive of radiological service. The next CPT is 50953. Urethral endoscopy through established ureterostomy with the urethral catheterization with or without dilation of ureter. And for image guided dilation of ureter without endoscopic guidance, you need to refer 50706. The next is 50955. Urethral endoscopy through established ureterostomy with biopsy. The next is 50957. Urethral endoscopy through established ureterostomy with fulguration and or incision with or without biopsy. And finally 50961. Urethral endoscopy through established ureterostomy with removal of foreign body or callus. Whenever we discuss about endoscopy, it will be established ureterostomy or new ureterostomy. These are the CPTs for established ureterostomy. And the next session, that is 50970, it deals through ureterotomy. It is not established. Here ureterotomy is being performed. The first CPT is 50970. Urethral endoscopy through ureterotomy with or without irrigation, instillation or ureteropylography exclusive of radiological service. The next is 50952. Urethral endoscopy through ureterotomy with urethral catheterization with or without dilation of ureter. The next is 50974. Urethral endoscopy through ureterotomy with biopsy. The next is 50976. Urethral endoscopy through ureterotomy with fulguration and or incision with or without biopsy. The next is 50980. Urethral endoscopy through ureterotomy with removal of foreign body or callus. Now let us see an example. A patient comes in for removal of callus from ureter via urethral endoscopy through an established ureterostomy. So here the CPT is 50961. Urethral endoscopy through established ureterostomy with or without irrigation, installation or uteropylography exclusive of radiological service with the removal of foreign body or callus. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.